Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
We will discuss part 2 of women sexual dysfunction today. We didn't take much time last time because of the circumstances, but today we intend to cover the remains of the topic and share something else with you. We spoke the last session, last week, about women sexual dysfunction, and we said that even though 1 out of 3 women have sexual dysfunction, it is a lot less pronounced when compared to men. Men talk about it, the statistics are there. Women are very much shy of talking about it because of culture and religion reasons. Nevertheless, like men have sexual dysfunction, women also have sexual dysfunction. And we said the anatomy when it comes to sex is very much similar, except for the penis in a man is very much noticeable, but in a woman, the similar structure would be something called the clitoris, which is right on the top of the urethra where you urinate. So that is the clitoris, and we said, like men, the whole key of sexual excitement is blood flow. If you have limitation to the blood flow, you will not have good erection. By the same token, if you have limitation to the blood flow, to the pelvic floor, to the woman, you will have also sexual dysfunction. And we categorize, and I like to repeat, the women's sexual dysfunction, just like men, are divided into 4 categories. We can have a problem with desire. Desire meaning, the head. Something is wrong with desire. That means something is wrong with the head. What could be wrong? Psychological reasons. Psychological reasons like low self-esteem. She does not feel good about herself. She looks in the mirror. She sees that she is too fat or too skinny, or this is out of shape, or that is out of shape, or the hair looks like this, or the nose is too big or too small. This is low self-esteem. You are not confident about how you look. You as well cannot take the idea, what if I take off my clothes and my husband will see my breasts? That doesn't look too good. Well, those are all things that disturb. Those are all things that disturb the esteem, the confidence level of a female to have sex, good sex with a man. So low self-esteem is one of the psychological reasons that a woman will have low desire, hypoactive desire, okay? Like men, when a man feels threatened, and this happens when the woman is more experienced than the man, like she had ex-boyfriend before, and some of them are not really in full mentation, and they like to speak about their previous experiences, and the man feels less of a man, and he feels threatened. And that is one of the most common psychological reasons for male sexuality or sexual dysfunction or impotence or low erection, weak erection. So, and I get a lot of those young men with sexual dysfunction. A woman applies the same thing. So we all the same when it comes to sex, men or women. We may have different fat distribution, different anatomy when it comes to the reproductive system, but psychologically we both the same. Men, when they feel threatened about their manhood, that they are less of a man, he cannot erect. A woman, when she feels threatened or she feels not comfortable with her figure, you know, the breast is too small, the breast is too big, the curves are not appropriate, the face doesn't look too good, the hair doesn't look too good, she is not confident about how she looks, especially when she takes off her clothes in front of a man, she feels not comfortable. So when you get that feeling, obviously the next step is you will not have a good sex. This is what we call desire disorder. Desire disorder. So desire disorder is all about psychology, your self-esteem, your level of confidence when you are with a man. You don't feel as you will satisfy that man because you have defect in this and you have defect in that, and that the man is going to look at you negatively and he's going to give you a negative feedback, and this is all playing in your head. So you are confused. Should I have desire and continue with having good sex, or should I be thinking what is he thinking about me at this moment? And this fight that is going on in your head will definitely affect your desire as a result of your low self-esteem. So the management in this case is what? The management is psychotherapy. What is psychotherapy? Communication between a sex therapist, somebody who knows those problems and can treat and deal with psychological problems, and the couple. Not each one differently. No, they have to be together. So we discuss the psychological problems that affect the man and affect the woman. So it's about communication. Psychotherapy is nothing but communication and touch the weak points. A therapist will recognize what is the woman's points of self-esteem and how to manage that. There is a psychotherapy, behavior modification therapy that we can do to bring the self-esteem up, to bring the level of confidence in that woman figure, how she look, how she speak, her personality, will bring it back up. Once the woman have confidence about how she looks, how she speaks, how she reacts, how she responds sexually, then the sex will be much better. Not only for her, for the man also. When a man have a good sexually responsive woman, he has everything he needs. So sexual response in the woman part is a main let's say principle, okay? It's something that is very important when it comes to successful relationship. A relationship without good sex is a very fragile relationship, right? We all agree on that. So this is the desire disorder. What else can we boost the desire in this woman? Well, there is, like we said, testosterone can boost the desire in a man. Testosterone also can boost the desire in a woman. Well, we have to be very careful when we say drugs names, because I am not saying that so you can go and get this medication or this or that medication. No, it has to be very carefully calculated. Why I'm saying that? Because if you take an extra dose of testosterone, you bring in the worst. And I've seen patients, testosterone is very high, but yet they have an impotence and they caused a lot of damage. We will talk about that also in a bit. But so that means only a doctor and only a good laboratory results can tell me if you need testosterone or not. And I'm going to give you some scenarios whereby testosterone is good or even high, yet the desire is low. There is other reasons. So now, if I say testosterone is good for those who are low in testosterone. Testosterone also is good for a woman to bring the desire up, but if she needs it. So when I say medication, doesn't mean that you go out there and look for the medication that I say. Everything has to be carefully calculated and everything is adjusted by dosage, and only a medical professional, a licensed medical professional can advise you take this and not take this. It is not like on a sidewalk where you go buy some medication and you think it's going to work for you. It doesn't. It actually causes a lot of damage, and we're going to discuss, a real case that I just encountered a couple of days ago. I will share it with you after I'm done talking about women dysfunction. Now, so this is the desire disorder. So we're going to boost it with two means. If it is because of physiological reasons and is because of lack of low level of testosterone, whether men or women, we're going to boost it up by giving some testosterone based on the findings of how is your level of testosterone, not random. Now, psychotherapy is very important because we're going to fix the problems that make this woman not very comfortable of how she looks with the feedback that she will get from her husband. There are many issues, communication and good sexual therapy, good behavior therapy, and as a good sexual therapist will be able to address the problem in 1 or 2 sessions, and everything is clear and the couple can practice their sexual life, healthy sexual life, very comfortable, and the relationship will be even a lot more stronger. So there is no need to look outside the relationship for somebody who will give us satisfaction. If the wife can give you satisfaction, and if the husband can give you satisfaction, full satisfaction, there is no need to look outside the relationship. Why I'm saying that? Now let me, before I forget, I got few questions, and they both, and those are recent questions, even though I have addressed them before, but they all about the same thing. Doc, I am pregnant, but did I get pregnant in January or I get pregnant in February based on calculating the ovulation date? Why did she ask that? Well, some of them ask you like this, and some of them come straight and tell you, listen, I have sex with guy number 1 this month, and I had sex with guy number 2 this month, and I'm now pregnant. Is it guy number 1 is the father or guy number 2 is the father? And some like to play smart, and they say, okay, but anyhow, the doctor understands, just by you saying, so it's advisable to be very open and very honest with the doctor, because every piece of information you say, it means something to him. So you have to be very open and very, very honest on what you say, because that will help you. The doctor is not a judge, is not a policeman, is not a detective. His main concern is your health. So the more open and honest you are, the more accurate the diagnosis would be, because history is a very important part of establishing a correct diagnosis. Now, answering to those questions, because I have like few questions around the same thing. We know how to calculate the ovulation day. We did it before. We will not do it again. Watch my videos, and whether on my Media Prime page or my Facebook page under Dr. Suleiman Clinics and Labs, all the tapes, all the videos are there. You can go, and everyone is titled. You can go and search. Like I said before in one of the sessions, I have mentioned that like you have memory cells in the brain, you have also memory cells in your heart, and you have memory cells in your uterus. So there is memory cells in the uterus. What is the function? What will those memory cells in the uterus will remember? Well, what gets into the uterus besides sperms? Sperms. So this uterus, this memory cells inside the uterus, they can memorize the sperms. How are they going to memorize the sperms? Let me give you a small analog. This is a fingerprint, right? Not two people having the same fingerprint, right? It's different. The same thing, the sperms. The sperm don't have fingers, but they have what is similar to a print. What is a print? Each sperm is made of genetic materials, right? Like DNA. So now this genetic material is composed of bases and nucleotides and some parts. Let's call it parts. Now, let me give you a small example. I have number 1, number 2, number 3. Those are 3 numbers, 1, 2, 3, right? I can put it in this order. 1, 2, 3. That is one sequence, one order, like that. Now, I can put it 2, 3, 1. That's another sequence. I can put it 1, 3, 2. So I can change those only 3 numbers. I can change them in so many ways, so many arrangements that are different one from another, yet they are the same. Number 1, number 2, number 3. So the order has a change. And that is exactly what we call sequencing. So if I change, that is one guy have a specific sequence that the uterus will memorize. If you have sex with a different guy the following month, now the uterus is confused because he's only used to memorize that sperm with that specific sequence. The genetic coding of that sperm is being memorized by those uterus cells. When I confuse the uterus with many other sperms from different other men, what do? I confuse the uterus. Is that good for the uterus? It's very bad. Why? Because the uterus now is confused, and that is the onset of many diseases. Some of it we know and we can treat, and some of it we are yet to know. We do not know yet. You understand what I'm saying? So what is the solution? Be with one guy at the time. Be with one guy at the time. If you want to change guys, allow 3 months and 10 days break between one guy and the next guy. Why is it 3 months and 10 days? Because this is how long it takes to make new memory cells in the uterus. The old cells will die off, new cells are being made, and now you have a new guy that will remember, the new guy with new sperms, that this new memory cells in the uterus will recognize those new sperms. Okay, so and this is researched and has been confirmed by scientific evidence, and I'm not talking from space. I'm talking about based on scientific evidence. Okay, medical scientific evidence. So it's recommended, strongly recommended, that if you're gonna change guys, then you have to allow 3 months and 10 days between one guy and the next.